Hello, my name's Marianne Williams, and I'm a specialist gastroenterology dietitian. And today I'm going to talk about diverticular disease and the dietary advice for this condition. I have a lot of patients who, for instance, have gone for investigations because of gut symptoms, and they've been told as part of that investigation process that they have diverticular disease. And they're not quite sure what they should do about this or what dietary advice they should take. And there's a lot of very old, conflicting advice out there. And I just want to make everything clearer. So before we continue with the diverticular disease advice, I want to really highlight the red flags. Now, if you've got any of these symptoms, you must go and see your GP straight away. So, blood in your stools, unexplained significant weight loss, not just a little bit of weight loss, but quite a lot of weight loss that you can't explain, unexplained low iron levels, a sudden change in symptoms. So, if you've been somebody who's always had constipation type of stools, and now suddenly you've been getting diarrhea regularly, not just a one off, but regularly, that's a change in symptoms and you need to see your GP. Or if you're waking at night regularly with your gut symptoms, so not just waking every now and again with your gut symptoms, but your gut symptoms are actually waking you up consistently, maybe several times a week, you need to go and see your GP. Okay, let's look at diverticular disease or diverticular. So, this condition affects the large intestine, also known as the colon or the large bowel. And you can see it here in red. The small intestine is not affected by this condition, but there's lots of different terminology out there, which gets really confusing. So, you can see in this picture there's a scan, and it's highlighting some of those little pockets in the bowel of this person. Now, diverticular or diverticulosis is simply a term to describe those little small bulges or pockets. Diverticular disease is a term used when those pockets are starting to cause lower left sided pain in the abdomen, or there might be diarrhea and or constipation, and there might even be rectal bleeding. But generally speaking, we're talking about people getting lower left sided pain. Now, diverticulitis is when those pockets get infected, and that results in a raised temperature. So bear that in mind. If you've got very severe pain but no raised temperature, then that's very unlikely to be diverticulitis. Now, what is the reality of who suffers from this condition? Well, diverticulosis, where we're talking about just the having those little pockets, is actually really, really common, affecting about 65% of those over 65 years old. And the condition could be inherited or it could be caused by diet and constipation. But the really important part here is that the majority of people have absolutely no symptoms at all. Only 10 to 15% will develop abdominal symptoms, and there'll be no inflammation seen with that. And only 5% will develop diverticulitis, which is associated with the raised temperature. So actually, diverticulitis is really not very common at all. Now, if we look at constipation and how that affects you having diverticulitis or diverticulosis, it's where the impacted and hard stools and the straining can put extra pressure on that bowel wall and create weak spots. And you can see really beautifully here in this picture how you've got these pockets in the colon which bulge out, and these cause pouches or diverticular. So, what is the advice? Now, the new updated advice is that you eat a healthy, balanced diet. And the really important part of this is that you no longer need to avoid nuts and seeds and fruit skins and popcorn, etc. So, this is really important. All the old advice took us away from having fiber, told us not to have nuts and seeds and fruit skins, etc. That has been completely reversed now. They want you to eat a lot of whole grains, fruit and vegetables, increase your fiber slowly, and drink sufficient fluid, 1.5 to 2 liters of non-caffeinated fluid a day. That's actually a very significant part of constipation, as well as that people are not drinking enough fluid. Because 1.5 to 2 liters a day is a fair amount of fluid if you're taking out of that your tea and your coffee because they're caffeinated. So, really important that you make these changes. But these changes are simply healthy eating advice. So, plenty of fiber, what they've discovered now, actually helps reduce the risk of developing diverticular disease. A diet high in fruit and cereal reduces the risk of hospitalization with diverticular disease. And they now realize that if you've got uncomplicated diverticulitis, where you've got that temperature and you're feeling really lousy, even if you've got that and it's an uncomplicated diverticulitis, then you really shouldn't have any restrictions on your diet at all. So, lifestyle is also seen as very important in preventing diverticulitis or diverticulosis or diverticular disease, and stopping smoking, weight loss if it's advised, increased physical activity if it's advised, which will also help keep your bowels moving, and a laxative if it's advised, because this may help prevent constipation occurring in the first place. So, I would say the most important learning point from this so far is that for diverticular disease, you do not need to avoid nuts, seeds, popcorn, and fruit skins. It's really important that you don't. In fact, we want you to have more fiber because that actually now reduces your risk of getting diverticular disease. So I get a lot of people coming to me saying, "Well, look, I've made all these changes. I'm doing everything I'm told to do now for diverticular disease, and my symptoms have got worse. They're certainly no better, and they've actually got worse. So, what is causing my problems?" Well, the truth is that IBS and diverticular disease can have incredibly similar symptoms. So, the question is it the IBS or the diverticular disease that's causing your symptoms? Well, patients with IBS are often sent for investigations to rule out other conditions, and they might be diagnosed with a diverticular disease as part of these investigations, as I mentioned at the beginning. But remember that only 10 to 15% of those with diverticular disease will actually develop those abdominal symptoms, and only 5% will develop diverticulitis. So, therefore, for the majority of patients with a diagnosis of diverticular disease, but with no history of diverticular infection, then IBS is the most common cause of their continued gut symptoms. So, in fact, their gut symptoms are not being caused necessarily by the diverticular disease, they are being caused by IBS. So, when we look at that eating advice for diverticular disease, we're encouraging eating whole grains, fruit, and vegetables and increasing your fiber gradually. Now, both of these can be potential triggers for IBS symptoms. So, although they're all healthy eating, absolutely what you should be doing for diverticular disease, they can actually aggravate IBS. So, what we need to look at really is a combination approach where we're putting a diverticular disease diet and an IBS diet together and working them together. So, to prevent IBS and diverticular symptoms, we need to aim to eat a healthy a healthy diet that reduces the intake of foods that might trigger those IBS symptoms. Now, I've put together a free IBS first line advice video on the website. So please do watch that because that gives you some of the basic advice for first line on how you might reduce the triggers for IBS symptoms. Now, if your increased fiber intake leads to continued or worse gut symptoms, then consider using high fiber foods which do not ferment in the gut, e.g., low FODMAP foods. Now, there are certain foods that we eat that actually cause fermentation in the gut, and that fermentation process can cause wind and bloating and abdominal pain and nausea and reflux, etc. All these are IBS type symptoms. And if we reduce these fermentable foods in our diet, as in the low FODMAP foods, then we can reduce those symptoms. So you can, in effect, combine the best of the low FODMAP diet along with the best of the diverticular disease advice. You may find that your symptoms, your gut symptoms reduce. So I've produced a what we call a blog or an information page called Gut News on the website, and that's got a specific section on diverticular disease, which you may find helpful. And I mentioned that I've got the IBS First Line Advice webinar up on the website, so please do look at that. And there is also available a low FODMAP diet webinar as well. So thank you very much for listening. Don't hesitate to email me on help@gutdiet.co.uk if you've got any questions. That's help@gutdiet.co.uk. Thank you for listening. Goodbye.